All right, folks. So we're here today with Dr. Eryka Simmons, who's head of general practice at the Health Services Authority, and she's going to tell us a little bit about, all the different areas really of the hospital, because I know there's different campuses, and sometimes people might get a little bit confused about if I'm having this particular issue, where do I go? So this is a question I'm sure, Dr. Simmons, that you probably get a lot. People walking in, is this like, do I go to the emergency room? Do I go to GP? Where exactly do I go? So let's start off by talking about what the different departments are where you can actually get immediate care at the Health Services Authority.
Hi, Sandy. Thank you for having me, and to your audience as well. So like you said, we do have a lot more options for immediate care with Health Services Authority now, and that would come with some confusion for some patients, understandably. So we have the emergency department, accident and emergency department. We also have the urgent care walk-in clinic, and we have general practice clinics.
Mm-hmm.
So for patients, we just need to know when to access which one and where.
Yes. Okay. So if I walk in to the hospital facility, the main campus, and I have what sort of symptoms would indicate that I should really be going to the accident and emergency department?
Okay, so for accident and emergency, that's for severe life-threatening conditions. For anything that needs immediate attention or observation or will eventually lead to admission as well. So conditions, for example, would be chest pain, shortness of breath, suspected stroke, severe onset of a headache, persons who are, having suicidal thoughts, or even persons who are thinking about hurting others. Mm-hmm. All of these should be going to the accident and emergency department.
Mm-hmm.
That's not an exhaustive list. It's just
right.
for us to start, but there are so many others.
Okay.
I think I did mention shortness of breath. I'm not sure.
So that's interesting. So even if it's an urgent mental health need, you should also go to A&E for that.
Absolutely, yes. Anything that's going to be life-threatening.
Right. Okay. Wow. So suspected stroke, acute abdominal pain, would that also be one of those things?
That would definitely be one of those things.
Yeah. So any kind of head trauma, loss of consciousness, even broken bones.
Broken bones, definitely. If you suspect that you've broken a bone, you should go to the emergency department.
What about things relating to infants and young children? What sort of things would you take them to A&E for as opposed to general practice?
High fevers or seizures would definitely constitute as you taking your baby or child to the emergency department. Mm-hmm. As well, any child that you have suspecting of choking or have ingested anything and you're not sure, definitely should be going to the emergency department.
So potential poisonings or allergic
Absolutely,
reactions.
yes.
Yeah. Okay, wonderful. All right, so tell us a little bit about what services then would someone go to GP for? Like, how do they know that this is the right place that I should be?
Okay, so general practice is for your non-emergent conditions. Ideally, it's for patients who need comprehensive care for their chronic conditions, or for their diabetes, for their hypertension, asthma, all of those conditions. For patients who need to do pre-employment medicals, whether government or private sector, as well as, say, your immigration medicals, as well as for your routine wellness checks, your well woman screening, your well man screening. For patients who need refills on their chronic condition medications, that's also something you should access general practice for. If you have a wound and it needs dressing and you've already had it tended to, but you need a follow-up, we also have dressing clinics at the general practice clinics. And traditionally, we talk about GP, everyone thinks of Georgetown, the clinic in Georgetown, which is now located on the second floor at Smith Road Medical Center. But there is a GP clinic in every district. Bodentown Health Center, Northside and East End Health Center, as well as West Bay Health Center. So when we speak of GP, it's not just the Georgetown location, it's all of the district locations.
Okay. So there has been an actual move from the GP clinic for the one at the main hospital campus.
Correct. Yes. Traditionally, we were at the main hospital, which is where everybody knows us, but we moved, I think, in late 2022. Time kind of goes after a while, but we've been there on the second floor now, and then the pharmacy services are located on the first floor. So when persons come to the main campus of HSA looking for a GP clinic, you're not going to find GP there. You're going to find urgent care, which we will talk about some more.
Okay. All right. Very good. So are the district GP clinics pretty much equipped to handle all of the things that you've mentioned as the main campus, or are there certain things that perhaps you should go to the Georgetown location for?
Well, all of the district clinics, inclusive of the Georgetown Clinic, which is in Smith Road, they're all appointment based. That's how we differ them from the urgent care, which we'll talk about more, and emergency.
Okay.
They don't require appointments. However, a lot of times the district clinics are the first point of care for a lot of patients. So you might not have an appointment. It might be a condition where you can get a same day appointment, or if a person's coming with an urgency, we're not going to turn you back. We'll still evaluate you, treat you where possible. If it's something that needs immediate, more life-threatening attention, then of course we would arrange for ambulance services and you'd be transported to the accident and emergency department.
Okay, very good. And then urgent care. So a lot of people might confuse, I think, urgent care with the A&E department because, they're both kind of emergency situations. So really, what is the distinction between urgent care and accident and emergency?
Okay, so where emergency department is severe life-threatening conditions that need immediate attention, urgent care is non-life-threatening conditions. However, those conditions would still need same-day evaluation. So that would be like your cough, your cold, your flu symptoms, if in the condition of minor strains and sprains. Even some broken bones can also be evaluated and taken care of at the urgent care. As well, patients having persistent headaches that aren't going away. So not a sudden headache that's occurring with loss of vision that should be seen in A&E. But if you've had like migraines that have been going on and needs to be seen today, of course, that should be done there as well in the urgent care department.
Okay, so same day evaluation, but considered non-life-threatening.
Non-life-threatening.
Yes. And where is the urgent care department located?
Urgent care is located in the atrium at the main campus of the Georgetown Hospital. So as soon as you come to the entrance, you'll see it. Most persons would know it just after main pharmacy. You'll see the signage for urgent care department. Okay.
All right. Very good. Okay. So you have people who might try to bypass, general practice and go directly to urgent care or go to A&E. What's your advice to those individuals about why that's not the correct protocol, but why they should actually follow and go into the right department?
I caution them. I understand that human nature, we want to get seen as soon as possible, but your choices can have a negative effect on other patients. If you choose the wrong service or the incorrect service and you end up going to the emergency department for a non-life-threatening condition, what that does is you're diverting resources for a true emergency, and that could then delay their care or affect their care. At the same time, you're affecting yourself in terms of if you're going to urgent care for a condition that you really could have booked to be seen tomorrow or next week, you could just end up wasting a lot of your time sitting to be seen versus having an appointment, and you'd be able to better time manage. So it's not only about making sure that the resources are properly allocated for both the patients and the staff, but to make sure that your time is also better spent.
And then, of course, with the GP facilities, you can see the same physician, so you get continuity of services in terms of that as well, which can be very important.
Absolutely, Sandy. Thank you for bringing that up. That's one of the main reasons I want persons to make sure they have what's called a PCP, which is your primary care physician, which you would have from the GP clinics. Because what that means is you have that doctor who knows about you, knows your family history, knows your personal history, and is able to see where you come from and for you together to plan where you want to go, as opposed to going to urgent care where you're going to be seeing a different physician every time. So you're going to have to tell the story over every time versus someone who knows your health. So if it is a condition that you just need to get immediate attention for that or same day attention for that, then choose between emergency because it's life-threatening or urgent care because it's just a condition that's minor but still needs to be seen today. But if it's for your long-term health, or if it's for preventative health care, or if it's because you're out of your chronic meds, rather than sit down in urgent care for an hour or two waiting for a refill, you could access the refill clinics at the different GP clinics.
And what are the hours then? I mean, is there a time when GPs close, urgent care is closed, and the only choice you have is to go to emergency?
Okay, well, we all know emergency is 24 hours a day, 7 days a week. Urgent care clinic, however, is Monday to Friday, 8 a.m. to 8 p.m., but they also open on weekends and public holidays. And those hours are 11 a.m. to 8 p.m.
Okay.
GP is Monday to Friday for the clinics, and then there's a dressing clinic on Saturdays. But to remind everyone, it is by appointments, but just because you might not have an appointment doesn't mean you shouldn't try to still call to say, is there a same-day appointment? There might not be a same-day appointment in Georgetown, but you can get a same-day appointment at another option or one of the other district clinics.
Yes. Okay, that's very good. All right. So, how do you go about making sure that you get an appointment with GP sort of, as early as possible? Is there some good protocols to ensuring that you're getting through to see your physician?
Just call the main hospital number, 949-8600, and ask the operators to put you through to the appointment clerks, and they'll help you. If you don't have a specific physician, then they will just give you the next available physician. If you're trying to book with your regular physician, which I do advise, just find out when they'll be working at specific clinics, or when you do see your physician, just say, okay, when do you want to see me again? And then you can put it in your calendars to know when you need to book your follow-up appointments for. For the urgent care, you can just access them without an appointment, as we said, just access them for those opening hours.
Okay. So there are people who are listening to this interview and they're right, but I'm not sure if this cold is actually, I feel like it's life-threatening because I can't breathe or whatever, but how do they really make a good decision about whether this is a true emergency? Is it urgent care? Is it GP? Like, where do I go? What's the best advice you can give them?
There's nothing wrong with picking up the phone and even calling the clinics to just speaking to one of our staff. One of the nurses from the various clinics, they're happy to do what's similar to a phone triage. They'll answer your questions and they'll help to guide you. Well, I really think you should come in and go to urgent care, or no, we can see if we can get you an appointment this afternoon in one of the clinics. Everything seems urgent to all of us. That's natural. But if you speak to another person, they can help to guide you if you're confused, because we do have a lot of options. But I think persons genuinely know if this is something that is life-threatening.
A true emergency.
They should be, yes, a true emergency.
Yeah. And of course, things with children, because of their age,
nature, definitely.
and it might be a little bit different. I heard of a mom recently, her child was running a high fever. And I said, wow, this is not something you want to sit on and wait for days, because that can cause other issues.
No, there are conditions that we definitely don't want you to sit down. And I don't want anyone to take home that I want you to sit down and watch any conditions, especially for kids, those age groups, and in vulnerable populations, so our children, our elderly. If you have concerns, urgent care or emergency. And the staff there as well, once you get there, let's say you do go to emergency, the staff will triage you and they may say, okay, but this can go to urgent care. So they're not turning you away. They're just sending you somewhere that you can get seen and evaluated and sorted as quickly as possible, but also making sure the correct resources are being used.
Talk again, sort of to recap for everyone's benefit now, about the 3 different departments, where they're located, and how people can get access to them.
So options for immediate care at the Health Services Authority in Grand Cayman, you have the Accident and Emergency Department located at the A&E entrance at the front of the hospital. Urgent Care Clinic, the walk-in clinic, that's at the main entrance, the atrium, just after the main pharmacy location. Urgent Care is open Monday to Friday from 8 a.m. to 8 p.m. and weekends and public holidays from 11 a.m. to 8 p.m. And then the general practice services, there's a clinic in every district. They're open Monday to Friday from 8 to 5, and on Saturdays for dressing clinics. However, these clinics are primarily by appointments, but you still will be accommodated.
All right, wonderful. Well, Dr. Simmons, thank you so much for taking time out of your busy schedule to give us this very, very useful information. And again, folks, the important takeaway here is, the HSA wants you to go to the right department, the right area, so that you get the care that you need and you benefit the most.
Thank you, Sandy. Thank you, everyone.